Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week received a Bachelor of Science in Biology from the University of Arkansas and graduated from the University of Tennessee College of Dentistry in 2003. An avid attendee of continuing education courses, averaging over 100 hours a year. He is a member of the Coy Center of Excellence in Seattle, the ADA, the Arkansas State Dental Association, and the president of the Academy of Interdisciplinary Dental Facial Therapy. Practicing from Fayetteville, Arkansas, please welcome Dr. Wade Kifer, DDS. How's it going, Dr. Kifer?
Good, Sean. Good to be here. That's quite the introduction. You're pretty good at this.
Nah, dude, I know not what I do, man. It's just that's all about you, man. You got more stuff we could have talked about, but yeah, what a bio, and you're just such a smart dude, and can't thank you enough for your time today. I know how after a big weekend and stuff and getting back in, I know how busy you are, but I thank you for coming to the mic for a little bit just to hear a little bit about your story in dental in the dental world. And again, I can't thank you enough for your time. So I always like to start off, talk a little bit about sports. And I know you're a big Arkansas Razorback guy. Tell me a little bit about that. I remember when Lou Holtz was the coach of the Razorbacks way back in the day. You're probably just a little kid when he was coaching there. But
yeah, Holtz was gone by the time I was really becoming a big Hog fan. But here in the state of Arkansas, we don't have any other professional sports. So
okay.
It's all Razorbacks all the time, and we've got a new coach, so it'll be fun. I'm actually traveling out to Colorado this week to watch them play. So I don't have many hobbies outside of dentistry, but Razorback sports is one of them for sure.
Oh, that is so cool. I just love their mascot too. He's he's a mean little boll weevil looking Razorback. What is a Razorback actually? Is it like what kind of animal is it?
It's just a wild hog. And interesting story. They were the Cardinals up until a coach way back in the day. So they were playing like a wild band of Razorbacks hogs, and it just stuck. And so it's kind of where they got their name.
Ah, that is so cool. Yeah, I love that. Yeah, you don't want to mess with those Razorbacks, I tell you. Oh man, I see some of those, some of the movies of, go hunting them or seeing them out in the wild, and those boys don't mess around. They're tough little boogers there.
Yeah, it's something we will stay away from in the wild, that's for sure.
Oh, I bet so. So what about on the basketball and baseball? Now, how far are you from the stadium there?
I honestly live probably just about 10 minutes from the stadium. So
beautiful.
Pretty close. So we work with a lot of the athletes and everything, just taking care of them. So, it's good to be involved and gives us something good tie to the community for sure.
Oh, heck yeah. No, that's so neat that you're so close. And I bet the whole town shuts down for just, the different activities with the different sports, because that's the way it is across the U.S. and a lot of these towns, it's like kind of like religion almost. Shut the town down on Friday nights for high school football and shut it down on Saturdays for college ball, and then Sunday it depends if you got a pro team or not. But that's just so neat. I love that. But well, cool, man. I say we're gonna dental up now.
Sounds good.
So tell me, Dr. Kifer, at what point did you think I want to get into dentistry and I want to be a dentist? Tell me a little bit about that.
I was one of the weird ones, probably. I think I've always wanted to be a dentist since I can remember, and I didn't have any family that did it. I was just a science person. And by the time I was in high school and starting college, I already knew I wanted to be a dentist. And to me, it was just the perfect blend of, hey, I like the science, but at the same time, I'm getting to deal with people because I'm not made to sit at a desk and do anything like that. So I don't know. It worked perfect for me. And I know everyone has different reasons that get them into it, but I think you do have to like dealing with the public, obviously. And most of us are science backgrounds, or else we wouldn't have follow this path.
Yeah, exactly. I see a lot of dentists they're really into like biology and stuff, and it's like it's just so you got to be smart. I mean, all the dentists I've known are just smart people. You got to be smart to get into dental school and then to graduate from it. I remember my brother, he was going to dental school. I think after 2 years he could have went either into medical school or stayed in dentistry, and it's just so close, those last 2 years. Okay, let's go to dentistry, I guess. But
that's cool. I never knew your brother was a dentist.
Yeah, he's not a dentist. He couldn't cut a crown prep for the life of him, but he could do a root canal all day long. Yeah, the Navy gave him a scholarship to go to dental school, and then he had to do like 8 years or 4 years or 8, and then after the 8 years, they said, hey, we can send you to 2 years to specialize in endo if you want to give us 2 more years. And so he did that, and it was a good choice for him. I mean, a lot of these fixed, GPs and fixed fixed praxis, fixed prosthodontics, they can go up and down, and it's just, it's a great field for sure. But a good specialist in town, like where he's in Greensboro, North Carolina, and a couple hundred dentists in town and only a couple practices limited to endo. And so it's been a boon town for him just to be in an area that, and he gets all the hard, tough ones, all the GPs like they should.
Oh, yeah.
They do the easy ones and what they can do and feel comfortable with, and they send the nasty, hard ones to the endodontist, and that's the way it should be, But
but no matter what's going on with the economy, I mean, people's teeth, that have been worked on, they go bad. So endo is definitely something that if you've got a knack for it and the ability to do it, I mean, I think it's almost recession proof.
Exactly. So. I always kind of kid around. My buddies always tell me, I've been doing this since 84, and, there's been peaks and valleys in life, and, with the economy especially. And I worked for a company for almost, 17 plus years. And then I started my own in 2002. And that was a tough time back then, 2001, 2002, 3, 4. I mean, it was not a great economy, but teeth are kind of recession proof in a way. I mean, people are always going to need teeth, especially the onesie twosies, not a whole lot of the cosmetics when we're doing full rehabs or cosmetic, 4 through 13 type things, or 6 through 11s, 20 through 27. It's a thing that's always going to be there, and it's been a blessing for us for me getting in this field. I remember buddies all laughing at me when I'm gonna be a dental laboratory technician, and it was like $3.35 an hour back in '84. Wasn't a lot of money at the bench,
yeah.
But it worked out, man. And just I see all these other companies, just certain businesses and in general that like malls and just on, just the brick and mortar stores, and it's just life changes. And even with us with the lab end, it's tough with when CEREC came out, and that's been out for a while. You thought about it back then. I remember thinking, we're gonna not have lab technicians, and it's gonna be a while, I think, before we're eliminated, if we're ever eliminated. But I just think I've been blessed for sure. A dental tech. I think you being a dentist, man, because you're freaking crushing it, dude. I mean, you really are kicking it hard. And I mean, we've been together like 10 years, and you've always been on the cutting edge, man. But it's just.
I think we've even been together longer than 10, and
I think so too. I was asking Bob.
Things will change, and when we talk about the technology and everything coming out, you can't look at it as how's this going to change what I do? Because I think, obviously our mindsets still matter, and how we do things. It's just another tool. I mean, I'm so excited the way things are coming with just the thought of being able to print a digital mock-up, that I can transfer to the patient's mouths, and it's amazing. What kind of technology are you guys looking forward to, and what are you doing going forward? Because it doesn't change how we do the dentistry, but we want to use it to make things better.
Absolutely. And you're so right. And it's an exciting time in dentistry. I mean, we've been doing this a while, and it's so neat how it's so much more predictable now. And, especially guys like you, I mean, you've always been on the cutting edge of education, dental education. And way back, my general manager been with me for years, and you're a real big guy with Coys, Dr. Coys. And I just love him. I remember having him back 10 years ago or whatever it was. I'm not even sure the date. What was that? It was a while ago, but I remember having him here and just everyone and their brother. And we had an area upstairs that we didn't have built out. And we had 100 doctors in here sign up immediately, and we couldn't get any more. We couldn't sign anymore. We had to stop it. But I remember him flying in, and he's just a smart dude with just the techniques and just no nonsense. And, even Bob, he went through these courses, and, you fly out to Seattle, and I didn't even know him and Spear were partners back in the day, but both those guys. I mean, I'm just a big Kois fan though, just because I've been with him and seeing what he's done, and see what our pracs and dentists that have worked with Kois, how they just get it, and it just makes our job so easy, and we have to be up to snuff, to be working with these guys, because, you know what you want and you demand the excellence. And I love it. But tell me a little bit about Kois, if you could. I know you've been going through them for years. Tell me a little bit about that, if you could.
I started back at the Kois Center in about 2008.
Okay.
Started taking classes up there, finished in about 4 or 5 years. Probably the greatest accomplishment in my dental career, I shouldn't say probably, definitely the greatest accomplishment in my career was becoming a mentor up at the Kois Center. So I'm on a committee up there now, and I try to work with them quite a bit. But I try to go up there 2 or 3 times a year, help mentor other students that are coming through the process. The thing about John is he makes things so simple. Okay. It's all about, how can I do this the right way? And if you ever get the chance to go up, and I know, Sean, you've met him and had him into your clinic, and mm-hmm. I really wanted to come down when he was there, but couldn't make it. But, he's cares about his students. I mean, you leave there knowing, we call him John, not Dr. Kois, but he's your friend, and you get to learn from him. And I mean, there's not so many chances in life where you get to learn from the very best. And when you get that opportunity, you just try to grab hold of it and go with it.
That is so neat. That's such a testimonial right there for sure. And, it really is. And I know some of the younger dentists getting out of school have that debt, but it's almost like, you can't afford it, but you can't afford not to do something like that, to go see a man in a system like they have there. And it just comes back tenfold to you. It's some of the best. I mean, you learn a lot going through dental school, I'm sure, a lot of theory and everything else, but you'll learn real world techniques when you go see Kois, and you can bring them back, and it's just practicing great dentistry. That's so cool. One thing I hear though, man, is like, I'm so, my attention span's so short, and that's probably why I didn't go do all those college courses like you guys, but it's something that I heard, like the door shuts and he closes the curtains like at 7:30 in the morning or something, whenever the start time is, and then he keeps going and he doesn't stop. It doesn't stop. You go all night.
John has his what we call always rules, and one of them is class starts at 7 a.m.
7 a.m. That's it.
And so, like you said, he gets going, and you'll never go there and feel like you got cheated. It's 7 to 5 for most courses.
Okay.
And at 5:30, he's still going strong. The man is a machine, and it's open to questions. There's only about 29, 30 students in class. Don't quote me on the exact numbers, but it's raise your hand and ask John a question. And, he wants to make sure you're grasping the information, and it's not, hey, go back and just do this. He really teaches you why things work, why they don't. So the background information, all literature based, is just absolutely amazing. I mean, if I'm ever getting a little down, which doesn't happen very often, I can just go up to Kois Center and I just come back fired up and ready to go.
Yeah, I love that. Yeah, and that's what I hear. They're pumped, and he is such a humble man. I remember picking him up, and
most humble guy I've ever met.
I know.
For as brilliant as he is, you wouldn't think he could be that humble, but he really is just a great guy. Like
a guy you've known forever. I mean, when we met, and I drove him from the hotel down to our lab just to come see the setup the day before and everything for the next day, and he just, after 5 minutes of talking to him, it's like I've known him forever. And we just went on talking about, he's a real big EMAX guy, and he's just talking about his ceramics and what he pays them and all this stuff. And then he found out what I'm charging my EMAX. I said, Sean, how do you do that? And I go, well, your guy could do it too, but he probably couldn't afford just to be doing your work only, or I'm not sure. But just such a humble and just such a nice man. And I hear like his kid, his boy is working with him too, and he's a up and coming dentist and all that. Is the son kind of taking part of the business too?
Well, he's got two sons. One of them actually runs the business, Johnny, just a brilliant business and technology mind. Great guy.
Okay.
Dean is his other son, who is a prosthodontist with a big surgery background.
You're kidding.
Dean actually flew out here and talked to our study club, does a lot of surgery, a lot of implants. The apple definitely didn't fall far from the tree.
No kidding.
With either one of them, just family. And I know his wife works in the business, his new daughter-in-law, she works in the business. So it's a great organization, and I'm just honored to be a part of it.
Oh, that is so neat. That is really awesome. I love hearing that. So tell me a little bit about too. It's like, I heard he has a nice little boat. You guys kind of go and do some of the stuff on. I heard he upgraded that boat a little bit too. Kind of a big one, but that's where the courses are actually on his yacht, huh?
No.
Okay.
Courses are at the center.
Okay.
But he does take us out on his boat for a dinner every time we go up for a course on usually Friday night of a 3-day course. The second night of a 3-day course, we go out and enjoy dinner with him and his family on the boat. And it's a really good chance just to kind of get to know everyone on a deeper level. And, the center is great and I learn a lot, but the friends you make there and the mentors I've got just going out there, getting to know people, it's a big part of this business. When you're practicing alone or you don't know people, to be able to share stories. And your labs helped me, especially when I was real young, with cases and going through things. It's good to get to know other people in the business, because you don't know what's even possible till you see it done, unless you're just one of those crazy trailblazers, which I'm not. Getting together with other dentists that are like-minded and think like you do, it fires you up and keeps you going and gives someone to bounce ideas off of. So that's a big deal.
That's so neat. I love hearing that. No, it does. It pumps you up when you get talking with your peers that are, doing what you're doing and trying to achieve greatness if you can, and try to practice this great dentistry. And that's just so awesome. No, hats off. And yeah, we got to get more of our doctors into COIs, and we're going to really push it, because I have some doctors that could really benefit from it. They've got the skills and they're really great. They're on the cusp, but I just think we need to work in some areas, and it's better not coming from a dental tech a lot of times. But yet if they can somehow get out there, even if we have to help some of these guys out that can't afford it, it's in my best interest to get these guys practicing better dentistry, because the more I can get them kicking butt and doing the proper right things, it's just a better off for us as a lab. And so I invest in dentists.
Don't sell yourself short, because, I've learned a lot from you guys and other lab people. It's all a team effort. We're not here as no one's better than anyone else. And we even tell our dental team that, we're all in this together, and
exactly.
Ideas are welcome, and we all have different roles, but it doesn't make anyone's ideas better or worse. It's a team thing.
Oh, absolutely. Totally a team thing. And I've always said it too, with the dentist and us, we both work for the patient at the end of the day. So whatever we can do to help them achieve what they need, be it function or fit or aesthetics, that's what we do. And when we think that way, and yeah, we do. We have got a lot of experience and we can help guys for sure. But we love it too when a dentist is open, to ideas, and because we see a lot of dentistry, and I've got a team that's been with me for many, many years, and it's so neat nowadays. It's just so rewarding I think the whole thing with, we get on a few podcasts talk about it. It's just the strength of some of the ceramics. I know you're a big Emax guy, and we do a ton, and that stuff works great. Not a whole lot of breakage, but for all the PFM years that I've done a million PFMs, and man, there's just some popping and cracking here and there when you're flexing that metal. If it's a higher gold, if you're a white high noble, you're up in the 60% gold content, and you got iridium, indium, zinc, and other trace elements that are working on these alloys to get that bond layer, and then you got these opacers, and it just can run. There's a lot of moving parts to do a PFM, and at the end of the day, all the beauty and everything else, and you got to try to insert it in the mouth, and you get a little bit of flex here and there, and you might get a popping here, and that stuff just drives you crazy. And I got my silver hair in my 20s because all those PFMs popping, man. It's like, what?
Well, Sean, I don't think I understood a word of what you were saying as far as all those different materials or anything. That's why we leave the expert stuff to you on that.
Oh, but man,
we want it to fit, look good, and not break, right?
Exactly. And to get that done, man, it took a lot of stomach lining of years. And now it's just, it's becoming more predictable now. And especially too, as we start, printing things and like you're saying, and helping, these patients show them what we can really do, virtually and then real, show them and print it out and show it to them. And I was just watching a thing how, Dr. Corey, whatever, I forgot his last name, but he printed out an ear, and they were putting like implants to put it into the guy's side of his head. And I remember way back in the day, we used to do like ears and noses out of, flasking it like a denture. And it was just amazing. But now they got it to where they can almost, sink a few implants into the skull area, by the ear area, and then just design the most perfect ear, contralateral from the other side. Just go those specs, do it on the right side, print it out, and these materials that they have, these different, materials that are just lifelike, and you're just kind of screwing it in like an implant, kind of holding it in place, and that's covered up with a nice little cosmetic tissue flesh composite over the healing head, and it just blends so nicely in the mouth in the facial area. But it just on and on with the printing of models and teeth, and also the scanning of impressions that are our polyvinyls and polyethers. They like to distort now and then. They're not 100% perfect, but they're pretty darn close when you're doing things right. But I just think.
Well, I don't have a printer yet, but one of the most exciting things I'm looking forward to is, most patients, by the time we do models and do a wax up and, create a jig and transfer that to the mouth and just a bisacryl, when the patients see the mock-up, they like it.
Oh, yeah.
The problem that I've run into is the time and cost of just doing all that. I mean, we send the case over to you guys and pay for a wax up, and then the time for it to come back. Yep. They're in a decent little cost just to see if it's something they're interested in. So technology hopefully does make some things cheaper and easier, because if we can do a digital wax up cheaper and then print out a mock up for $5-10 and then transfer that for just the bisacryl, I think we can sell more dentistry. And I don't mean sell in a bad way, because these patients need the dentistry when their teeth are worn down. But to invest $500 to $1,000 just to see if it's something they're interested in, that's a tough sell.
Oh, it is. And for years, I've been always advocating to my dentists, especially the guys that are cutting more facially, more cosmetic stuff, where we need to do these wax ups and or those custom temporaries. And a lot of times with, my younger dentists, and even the guys that, it's tough, and not saying selling it, but to show them is just so freaking, it's like a picture's worth 1,000 words. Like,
for sure.
And I would always say, you know what, send me those study models at least, get the patient in the chair, at least get me the study models. Let's see what it is, upper, lower, whatever you were working on, or both. And what I'll do is I'll do a mock-up on, a wax up, or I'll go ahead and cut them down, give you a prep guide, and do a custom temporary saying, okay, look we can do this 4 to 13, or we could do these posterior bridges. But then when you see that and what I'll do is I'll tell the doctor, let's do these. Sure, they're not sure about it. I'll charge it out for you, and then get it to you. And if they don't want to do anything going forward, I'll credit it back. And if they want to do it, I'll go ahead and credit it back, because I don't really make money off temporaries or wax up. I make money off of the fixed work. And I can't do that all day long, but I did that back in the day, when I started.
You did that for me once.
Did I? See, I knew.
Yes, sir.
I love doing that, because it's just, it's so, even Coy's had this thing with, these stick-on teeth that I forgot.
Tack teeth.
Tack teeth. And I gave away hundreds of those boxes. I was like his biggest user. And these tack teeth are so freaking bitchin', dude. They come in 3 sizes, like small, medium, large, and it goes from basically like a 3 to 12, 13, 14. So you got just these little, and they're all just like you peel it away and you can put it over the people's teeth and it can just show them what it looks like, visually right there, instead of doing something on a computer, mock up this and that. These tack teeth are so freaking neat. And it just shows the patient that the possibility of what we can do. Now, I'm sure certain patients, ortho they need and this and that and every which way, it's hard to do something like the tack teeth. But I just think between that
such a simple little idea that
exactly, and it's such
worth 1,000 words.
It really is, and they can take a quick picture on the phone, just kind of showing them, and it's just the neatest thing. But and the same thing with us doing, hey, a complimentary wax up or a complimentary, temporary. Let's just get the patient back, let them see it, and it's like the temporary you can't really go on and put it on because we got to prep down, and you can't really go and do the wax ups either. But like tack teeth you can. But on the other way too, it just when they hold it in their mouth and they bring it home to show their dad or their mom or their wife or husband, they're just going to look at the difference. And you have a pre-op model shows them looking like Dracula, and then it shows them the other one, the Hollywood smile, and they're like, honey, maybe we can't afford this, because at the end of the day, I tell you, there's just such a beautiful thing when you see someone that, doesn't smile or just is very conscientious of their smile, and always been that way. A lot of times you can just bleach them out, and they just getting them white kind of can help them a little bit, but just the whole thing of a beautiful smile is always in style. And I've always said
we had a patient you did with us literally probably about a month and a half ago. We just finished him, and same thing. We did the mock-up and we put it in his mouth. Big old guy. Yep. I mean, I had to leave the room because he said, "Hey, you're gonna make me cry." He's like, he didn't want me in the room, and it's just no idea.
It really does. And it's just the toughest men or the strongest people you think. And when it comes to, the being self-conscious because of a smile, and it's the most rewarding thing. I mean, I've cried many times seeing some smiles going into place and just seeing them. And it's just like the most rewarding thing. And I know just, your singles, onesie, twosies in the mouth, or you need that for function and getting people out of pain, this and that. But when we can really change a person's disposition on how they feel and, how just their confidence, and a smile would do that. And it's just I love it. And it's
I'm right there with you.
It's a neat thing, and nothing better. And it just, heck, I just did one of my buddy's grills, and he's just had teeth that are messed up, and he had these centrals that are always, he had like a diastema that his dentist was always putting composites in between there for years. And he was kind of a dental phobe where he couldn't get in the chair without, needing, whatever it is, just for anxiety or whatever, but almost had to be put under a lot for any major dentistry. And we finally got the dude after he kind of turned me down like 2 different times. I had Hornbrook one time all set up and he got in the chair. I can't do it. I'm like, Keith, get out of here. And then another time he backed out again, and I said no more. And then he finally called me and said, Sean, I want you to do them. But I said, I can't get you a dentist, dude. You're going to have to get your regular family dentist. And he went to his family dentist, and great dentist out of LA. And we finally got him in that chair, and he got him numbed up. And we did like the whole 4 through 13, just little veneers, and he had little tetracycline, little nubby teeth. And
nice.
We just did this thing, and we did it in one shot. Like he went in on a Tuesday, I got it, and I kind of wanted just to work on it right away, and got him in back on like Thursday. And yeah.
Maybe you need to open an office in Arkansas so I can do that same thing.
Come on, baby. We're going to have the dental arts team all over. Keating Dental Arts. No. But what a thing, though, for him. I mean, the dude's crying. He's my age, 55, and he's just crying in the chair. Just, Sean, thank you. And it broke me up. And, it just, I don't know. It's just, it's a neat thing. And I don't know. My wife says, you got to quit looking at every time you see your buddies or any people, you talk about their teeth, Sean. And I said, well, that's what I look straight at their teeth. And I've done so many girls for people that I know and people I don't know. It's like, I just feel sorry. It's like, here, I'll go to this dentist and here I'm paying this dentist his time and chair time and everything. At the end of the day, man, it's just, I love giving back, and what do I do for a living? I make teeth, dude. And it's like, yeah, I've made a lot of teeth in my time, and it's just something, it's nothing better. It gets me excited. I'm just like, yeah, I'm ready to go right now. Just thinking about whose teeth can I do? But I just got to walk out on the floor.
It's not work when it's your passion, I mean, when you get your passion like that, every day, I mean, not that you never have bad days, but the days are fun. You get up and you look forward to work and you feel that you're actually doing something, and
yeah, we love it. And even the text, like you send in pictures and even after the fact, and, we have the little quality control sheets that these texts, they're kind of bonused on them and stuff like that when you get all these great, reviews on your work. And they just, every day when the mail comes in and we kind of go and log in, the sheets on, the quality control sheets for each tech, and they can't wait to get them and look at them and then just get the praise and see pictures of after shots, and they take pride in it, and it's just it's a neat thing. And every day is like the playoffs. Like I look out my window here and everyone's working away, and we have all new patients today. Every day is new, every day, and you're only as good as your last frustration. So be on your A game.
When you say that, we do the same thing, because it's like, if you're not willing to, I mean, obviously you need to celebrate the positives, but if you're not willing to look at what didn't go perfect and what could we have done different, I mean, that's the only way you grow.
Yeah, exactly.
Whether you're lab or dental office or anything, it's just all about how do we get better every single day.
Yeah. And even like it's weird today, we come in after a big weekend, Labor Day weekend and all this stuff. And here I'm already like, I'm talking to my wife at breakfast this morning, and I'm like, God, I don't know. I just want to really find out what we can do better for the people, for a work and environment. Like, we're always pushing quality and standards of, quality for the lab, but what else can we do for just the day-to-day people working with, whatever it is, childcare, with, health, with weight, with eating, just trying to, as a company, try to figure out how, because these people are here longer than they're at home with their families. People are here 8-10 hours, and many years these people all been with me. But I'm just, I'm getting to the point where, hey, what can we do better to, because I don't know, man, we're doing really great, and things aren't bad. They've been the best they've ever been lately. And it's just like this year is just, my doctors, most of my offices are kind of booming, and just, it's picked up quite a bit. And, it just, I pinch myself, and I just want to make sure my people, they're doing great and setting records and all this stuff. But again, at the end of the day, what can we do to make them feel even better,
Well, when you run a business like that, your team's your family. I'm the same way, they've been here a long time, a lot of them. And it's more than just what you do in 8 to 5. Making teeth, don't get me wrong, that's nice and fun, but the people you work with, and you get to influence them more than you influence your patients and your customers. And
exactly,
it's all one big thing. We're all here together. So, how do we get better as people and everything? So.
Oh, absolutely. Now, we're always about the people, any company. I always say you could be any field, any job, but you're only as good as your people, and take care of them. Surround yourself with good people and take care of them and pay them well and treat them like family, and they're going to work hard for you. And they're, everyone has their ups and downs. It's life, and we all have our things, but it's kind of neat when everyone's kind of uppity, and I can see some people dragging a little bit today, a little bit, some, here and there, but that's just life, and it's just a great thing. And, to be able to come into work and just think about what can I do to make their jobs even better? I think I'm in a good place now. That I've always been that way, but I don't know. I was just thinking about, I was just reading some things about different companies, like the top employers, and reading about, well, what do they do different than these other companies? And a lot of it is just, a lot of personal things for their families, for their health, for their, child care, for, just charging their batteries at the right times, and just different things, I don't know. It's just, to have such problems to worry about, what we can do to make it better, but it's kind of neat, and because they deserve it, I just love it. I love it. I love it coming in, and I love talking to guys like you that you love it too, and your staff's so cool to work with, and just, it's a pleasure to work with you and your staff, and most of our doctors are like that, and they just, they kind of get it and they want to do a good job. And, this field, everyone says, oh, dentist, it's so tough to go see a dentist. I think it's changing. I think, in the last several years or more, it's not such a bad thing to go to a dentist. I think, it's more enjoyable than it's ever been. You're not as, back in the day, it was the whole thing, pain, I feel pain. You don't feel pain anymore. I mean, I got a couple implants. I didn't feel it at all. It was like a crown prep. Yeah. And it just, I think as the younger people start going into dentistry more and seeing dentists more, I think the dentists and their skill levels have really, it's, I think, in the chairside manner is, because this day and age, man, you got to be on your A game every time, because it's not like, we're all in a fishbowl, everyone in life now. It seems like he's like, you can't do nothing wrong. And I don't know. It's just, you just got to be human, but it's kind of the golden rule,
I definitely believe that, as there's competition and everything, it just drives you to be better, right?
Exactly.
If you're never driven to do anything different, then you just kind of keep doing the things you've always done. So, it's good for all of us to grow together.
Absolutely. And even, and get you out of your comfort zone like this. I did this podcast, man. I mean, I get nervous. I used to get nervous. I didn't want to do it. It's like, why am I doing this? Because I had this when Hornbrook was my clinical director, and I'm like, let's do a podcast for the dentist. And so then he left after a while. It's like, dude, what am I going to do? Who am I going to get another dentist in here? It's like, and I'm just thinking, let it go for a couple of months. And, in my stomach, it's just like, oh, Sean, you got to do it yourself, and it's just a matter of, it's not like we're selling anything. It's not like we're sponsored and every 10 minutes telling you about, buy this product and this and that. It's just basically about dentists, the real dentists that aren't lecturers, and some might lecture, but it's just real dentists. And, hey, I went to school here. I started my practice like this, and it's turned out to be something that I'm not nervous anymore, but I just, I was out of my comfort zone doing this. And, but yet now it's just something, I don't know, it's pretty neat. Just talk to my existing accounts that work with me, and a lot of them don't want to do it. It's like, nah, Sean, I'm not gonna do it. It's just audio. Just tell me about your story a little bit. But so I think everyone, you need to get out of your comfort zone a little bit. You can't just keep doing. If you always do what you've always done, you always have what you've always had. And that's a great saying. Right. You just kind of got to push yourself a little bit, and just like you did, you push yourself, and heck, you got 100+ hours a year in education. You don't need to do that, but you keep pushing it, and to go to COIs for years and years and years, and then now to be a mentor, you don't have to do that. You're doing that because it's in your heart, and you're pushing yourself. And I think it comes back to you.
I think podcasts like this are really good, though, because a lot of these young dentists, they do have the debt, and it's hard. I was talking to one last week, and she was saying, I so want to go up to COIS, or I so want to go up to Spear. And she asked how much it was, and we were talking, and she's like, I can't afford that. And she's making more than I was out of school, but the debt's so big for them. But things like these podcasts and the different groups on the internet and Facebook and wherever, it does at least give them an intro to a lot of stuff that lower cost, because when I came out, there weren't podcasts that you could easily access on different topics and groups that you could talk to. So, I'm a big fan of, I used to go watch my surgeon work and my periodontist work. I've picked mentor dentists and flown all over the country and watched them for a day or two in their office just to kind of get the CE. But technology makes that a lot easier now than it used to be. So, it's definitely something that gives us the advantages that we didn't used to have 15, 20 years ago.
Oh, absolutely. And, when you say that right there, I always had that in the back of my head that I've had some super, great dentists that are just in great areas with just lots of patients, and they got everything dialed in, from the marketing to the staffing, all the way till just their hand skills, in the dental part of it. And I just would say to myself, dude, guy would do 10 grand a month, but you know what? We'd have to do like $1,000 a month to business over because of certain little things. And I always wished I could, because I got doctors all over that are just crushing it and just really got it down. So, to send a Dr. Kifer, send a Dr. Carlson, or to send a Dr. Kanka to go to these practices, like, let me give you 3 or 4 grand a day or whatever it is. It's worth me 5, 10 grand to send you out or whatever, just to work with. And a lot of times it's with ego. These dentists didn't want to do it, because I've done it a few times with different dentists, but, that is just the neatest thing, and that, swallow your ego. Let this guy come sit with you chairside for a couple of days going through your practice, and just to have an adjustment of this little bit will get you this and just change your life. And a little adjustments, not big, huge things, a little adjustment here, a little adjustment here. Use these burrs here when you're doing your depth cuts here. Use this cord when you're double packing the cord and use an Impergum or whatever it might be, or get this scanner from, 3Shape. Man, it's just send your impressions this way, do your temps this way, make your temps, your contact circles bigger, broader, and keep your temps more in occlusion, and you're not going to get eruption. And it's just a freaking neat thing when we can have a doctor kind of go do that for other guys that have it, but they just haven't fine-tuned it. And I just think that's a great thing. And I'm going to put that back up on the top of the list too, on my KOLs, my key opinion leader type dudes that are Keating's KOLs, Keating's key opinion leaders, and my guys. And it's not opinion leader. It's almost Keating, freaking key hands down this or whatever. I got to come up with something, but just the guys that got it down on practicing dentistry, man, just to go, hey, go to this practice here. This dude will go from okay, I'll shut up.
Well, it all works better when we're on the same page. When the lab's on the same page, the dentist is on the same page, and the staff. It's getting us all together. Sometimes probably herding cats, but communication, that's the key.
So absolutely.
I'd say that's the biggest thing you've helped us with is, it's never a blame game. We can't get the shade or something doesn't fit right. Obviously we want to know if the impression's off, and you guys are great with that, but sometimes it's just hard.
Yeah. You got a little mouth. This person can't get it open. You got these retromolar pads or push it out in the back here. Yeah. It's so nuts.
And when we work together, we usually find a way to get it done. And
absolutely.
So no blame, just getting on the same team and going forward.
Absolutely. And it's just, I had an old high school football coach said, Sean, we got to be a cohesive unit. And it's like, cohesive. We got to be all one together. And I always say that, man, we got to be a cohesive unit, people. You're only strong as your weakest link. And it's just like anything in life, you just keep pushing it and working it. Oh, my guy sent me Keating certified dentist. That's what we're going to call them. Well, we can send a Keating certified dentist to your practice for 2 days, Tuesday and Wednesday. No, it's worth it, man. I tell you, man, I tell you, it would be worth it. Well, let me ask you a couple questions real quick. So on your dental schools, tell me a little bit about that, if you could, on how was it at Arkansas and Tennessee? Tell me a little bit about the likes and dislikes you had there going to dental school.
Well, we don't have a dental school in the state of Arkansas, so it wasn't really a choice to go here in the state. So basically, the state of Arkansas picked up my out-of-state tuition, and I had a couple choices, but I got accepted and went to UT Memphis.
Yeah.
I had a good experience. It's been a little while ago. I graduated 2003. The experience went well. You get out and you know how to do a filling, you know how to do a crown prep, you know how to take out a tooth.
Not to hurt somebody.
That's the real basics.
Yeah.
And so you don't even know what you don't know, though, when you first start getting out and start doing dentistry and you start going, oh, wait, why is that breaking? Why is that tooth wearing down? What's the difference in these two materials? They didn't talk about this material when I was in dental school. You got reps coming out and telling you all kinds of new things.
Yeah.
Or you don't know who to believe or what to believe, half the time. So, the school was a good experience. it'd be hard to go back and do it again.
I bet.
But at the same time, I'm glad it's over, and I love being a dentist now.
That's so cool. So tell me, when you got out, did you work as an associate or did you start your own practice? Tell me a little bit about that.
When I got out of dental school, I did an AHED residency for 1 year in Tennessee also. So did a lot of implant training and just some bigger cases, a lot of endo. When I got out of school, I basically was looking for a job. I was looking to buy a practice, thinking of starting up. I actually worked for an orthodontist a day or two a week, putting brackets on, just helping him out. And then I found a job with a general dentist, kind of phased out the ortho. So I did that for 1.5 years, 2 years, just kind of associate type position. And I always wanted to own my own practice, just my personality, knew I wanted to do it. There wasn't an opportunity to buy in where I was. Great guy. We still get along great. Found a little practice to buy here in town. Did that in June of 2006. Just a tiny little practice. I mean, we saw 1-2 patients a day.
No kidding.
And that was about the time I got hooked up with you. It was probably 2006, if I'm guessing. Don't quote me on the exact dates, but
I think you're right. I knew it was over 10 years.
Yeah, get out and start finding. I mean, what lab do you use? What do you do here?
Yeah.
I mean, what materials do you buy? I was all alone and slow practice, so we had time to figure it out. I've still got my dental assistant that I had then. So
beautiful.
Her and I worked together and just kind of grew a practice, so to speak. So
you have, man, and you're rocking and rolling it. So tell me then on your practice now, tell me the size of it. I know you got a couple of associates now. You got Dr. Bone and Dr. Johnson, man, a couple of rock and roll female dentists are kicking it, man. Tell me a little bit about them and tell me a little bit about your practice.
They're awesome. We were in a little building in 2006, and then 4 years ago, I guess that was about 2014, we moved to a new building. We renovated. We put in 10 ops, didn't finish out the whole thing. We're actually finishing out 4 more ops to go to 14 ops. So,
no kidding.
We just grew over the years. We've got an amazing team. Dr. Bowen and Dr. Johnson are both amazing clinicians, and just over the years, it's just grown. We've been blessed, and we try to take care of people, and hopefully it's worked out for our patients as well as it's worked out for us.
I think it has, man. I think it has, because you are rocking and rolling for sure. So tell me, what's like one of the favorite procedures you like doing? What do you like doing and what do you don't like doing?
Well, I'll tell you what I don't like doing. I do not like doing endo.
Yeah.
I always tell my patients, because they'll say, will you just please do that for me? And I always tell my patients, if I wouldn't do it on my wife, I wouldn't do it on you.
Exactly.
And I was doing endo, and it would take me 2 visits at 2 hours a piece.
Yeah.
They'd come back and they'd have post-op pain, and it'd be sore, and it'd look good on an x-ray, and I still don't know what I did wrong. And or they could go over the endodontist, and an hour later it's completed and they feel great. And I'm going,
yeah,
I wouldn't do that on my wife. You go see them. So that's kind of how I feel about it.
That's a good saying to say that. I mean, buddy, I wouldn't even do it on my wife. And come on now.
How's they gonna argue with you?
Yeah, how can they argue? I say that like I was in Cabo about a week ago, and I'm like, every 2 seconds, the guy's saying, hey, let's get on the boat. I'll get you the boat. I said, I get seasick. And they just stop instantly. It's like, hey, I got you on the boat. I got seasick, violent seasick. They go, they have nothing to say for it. So that's perfect.
Can you argue?
So what's been your marketing strategy? Do you do mailers, social media? What are you doing to drive people to your practice?
When I first started out, I think we did a mailer back then. We do a little bit. We make sure the website's up to date. Okay. We've recently started a couple of little pay-per-click ad campaigns. But to be honest, we work with a consulting group, Productive Dentist Academy. I've worked with them since about 2008. Okay. But we track a lot of just internal referrals. We have a huge internal referral system. I mean, we probably get 50, 60 new patients a month just off internal referrals.
Oh, that's money.
it sounds weird, but we really just kind of meet, like you mentioned earlier, of what's working, what's not. If we have a bad experience, we talk about it. What could we have done different? I mean, you're working with the public and you always just have some patients that take you the wrong way, but you say, what could we have done so maybe they wouldn't have taken us the wrong way? Yep. We talk about, are we greeting people with a smile? Are we looking them in the eye? Are we asking for referrals? Are we shaking their hands? I mean, it's just, we meet every month, more than once a month, but we often go over customer service and what could we do better? And just because something doesn't work out doesn't mean you didn't do wrong or did something wrong, but we try to learn from it no matter what.
Yeah. And I think that's as an owner, you don't want to hear that stuff a lot of times when you work somewhere, this and that. But as an owner, I've had it with dentists, Sean, this and that. You got to listen to it with an open heart too. And, if you don't listen to it, you're just not going to improve upon it, because at the end of the day, we both work for the patient. So, I mean, it's something that you just want to be treated how you want to be treated. And, you don't want to be all hot-headed. And some patients are like that. You can go and look at their Yelp reviews, or you can do a little history on them if they're doing a Facebook or a Yelp or something on social media. And you can kind of look at their back history, and some people are just miserable people, and, people will see that. And I mean, I've had very few like bad things, but when they aren't, it's like, there's a reason. It's like, you got to take the good with the bad and just try to improve upon it. But what you said with the whole thing with referral base, I mean, even me, that's from, Dr. Kifer, for you to tell 3 of your, peers, like, hey, Keating, man, I use them, this and that, you'll give me their names. And that just goes so far, with where we get our new business. And almost 9 out of every 10 doctors, their number one thing is not this big old Facebook thing and clicks. I mean, you'll get some stuff there, I'm sure. And that's still evolving into how to get customers. If you're not something directly online where they can plug in and buy it from you, it's another story. But to be able to just really take care of these people with a big heart and get referrals from your existing, accounts. That's where you're going to get all your business. And all my top guys, and for you, that company, we'll get that company's name again. Maybe we can get it on the website, on your company for the in-house, referral program you've been working with since 2008. What was the name of that again, Dr. Kifer?
Well, we just work with the Productive Dentist Academy. That's Bruce Baird and Vicki McManus's
we love Dr. Baird. I've had him on here. Yeah. Now that's good. You need a little system. You need little systems and back to dental school. They taught you enough not to hurt and kill somebody and to do the basics. But another thing they really didn't touch base or they don't touch base a whole lot on is, how to run a practice, business wise, and, and how to have that chairside manner. That comes natural in a way, but yet there is some things you can learn for sure. But
we like to tell, our team that it's not natural for everyone to get to know people. I mean, your personality is obviously one that can just link with anyone, but we practice linking with our staff, hey, how do you get to know them? Find 3 things you have in common with them. I mean, these things aren't natural for some people.
Absolutely.
And we tell the patient, or we tell our team that the patient, you may think you're being kind to the patient, but the patient may not perceive that.
Exactly.
So,
how to read a person and how to react with different personalities. Yeah, there's an art to it for sure. And some people
we can all get better at it.
Yeah. It's almost like that thing where you can't teach speed, but you can a little bit. You can give them techniques and just working on things. Same thing with people skills. I mean, a few things, here and there, and you can really read people. So a lot of people aren't really, they're more introverted, not extroverted in certain ways, just to try to appease them. And there's ways about it. And Bruce Baird's a great guy. I love that guy. He's a great dentist too.
I've worked with him since, like I said, I can't remember if it's 2008 or 2010, but it's been quite a few years. So,
he's a great guy. He loves to fish.
They were a big part of our practice turning around for sure.
Oh, see, that's so neat. You need that. You need a few people in your life with these different programs that help dental practices, and from practice management to a little bit of everything. And you just need to find the right ones that are peer reviewed, and you're hearing from your peers, and that goes so far for your dental practice. And it's just practicing smarter, not harder. That's what it's all about. So what about the latest piece of equipment you've got in your practice? What was that?
Well, I'm about to equip 2 more operatories. So we've got about everything in here right now. But if I could say one piece of equipment that's probably made my life a lot easier and my associates love it, honestly, it would be the Isolite.
Okay, yeah.
We use that thing on every procedure pretty much we do, just knowing that you have a dry field, keeping your patient open, just allows our sensitivity we don't have with our fillings or anything anymore, and just being able to work efficiently and do good work at the same time.
Oh, I love that. Hey, Tom Hirsch, man, I've done all his work forever. He developed that Isolite.
Oh, really?
Him and his brother, and he's right.
I've never met him, so.
Oh, he's a wild man. He drives his plane from Malibu over here to John Wayne Airport and brings the big cases, and he's just a wild man. But he practices big time dentistry too. He does a lot of all the stars up there. Not that they're any different than all the people, but we've done some big time people, and he's a full rehab. He likes to do the upper and lowers and everything. And but no, that
tell him we gave him a good plug, and
we got to, because when I put him on, we only did like a 25-minute, and we got to talk about the Isolite next one. But so do you have assistants, or do you use Isolite with an assistant, or no? You guys kind of go assistantless.
I guess I could work without the assistant, but we're so efficient. Patients sit in the chair, and we'll prep, and they'll kind of help rinse the tooth anytime I'm changing a burr or anything out. But then once we get a field isolated, we're just past it. It's just perfect, seamless teamwork, because no one's worried about retracting a tongue or holding a cheek back. It's just, we can relax. And I always like to say, if I'm having to think about what's going on, I'm not at my best.
Exactly.
It's at this point in my career, it's just almost seamless. And so with the Isolite in, it's just seamless with me and the assistant. So yes, I work with both, but everyone's different, I know.
No, that's so neat. I remember way back in the day, they had some issues with the light, and it's like, dude, just put some loops on your head. But they still having some light issues on the end of the thing, or do you just use your loop lights?
Well, the ones I have all been fairly older, and the lights have all gone out. So, but I don't miss them. Like you said, between the overhead light and I have 4.5 magnification in my loops.
Yeah.
If the light was on the Isolite, it wasn't that much difference than just my loops. So I never noticed it. That's
what I figured. And a lot of guys said it, but everyone has haters out there. Oh, the light, this and that. And then there's another one that came out a little bit cheaper, but no, the Isolite, I've worked with one in my mouth, man. It keeps your mouth open. It's just the neatest thing. And what a brainstorm session they had to get that, man. You don't need an assistant. It is pretty neat, and suction and everything. And I think there's some issues too, a little bit with, the new pieces to get them sterilized or this and that. But, I don't want to keep buying them. It's like, dude.
Oh no, they're disposable to us. They're one-time use, and it adds a couple dollars, but for what it saves us in time,
I know.
Well worth it.
That's what I always say with my guys, that, I'm buying this impression material because it's like $4 cheaper than Impergum, but I'm having issues. Well, pay the extra $4 and use Impergum, dude. You'll never have issues. I'm just a big polyether guy. Polyvinyl's work, but it is what it is on that thing. Well, dude, I know you got a patient here in about 5 minutes, man. Let me wrap up with just one more question now. What advice can you give some of the newer dentists just starting out, Dr. Kifer?
And it kind of goes without saying to me, but invest in the education when you can.
Yes.
And there are some cheaper ways with podcasts, and I know you've put on some programs in the past, and ways to get into it. Obviously, I love the high-end education you get from guys like John Coyce and some of the other big groups, but then don't neglect the leadership and communication. Your team looks at you to be a leader in the practice, and you set the tone, so take responsibility when things aren't going well and give the praise when things are going well would be my advice. So leadership's a skill, I think, and communication that often get overlooked, because you can be a great dentist, but if you can't sell the dentistry or get your team on the same page, then it's hard to go anywhere.
Oh, absolutely. Great words of wisdom right there, man. So how's my lab doing for you? We're doing okay? We screwing up a lot?
You guys are doing great. And like I said, your strength to me has always been communication and working together on it. So, if there's a problem, we can call and talk it up, and it's never a blame game on going back and forth or anything like that. So I appreciate all the work you've done. I try to send people your way for all the time, and
I thank you.
Couldn't be happier, sir.
Oh, well, God bless you and your family, and I can't thank you enough for your time, Dr. Kifer. You're the man, baby. Whenever you're out here in Southern Cal, we'd love to have you come by the lab. We'll treat you like family, and we'd love to have you see your techs. And we got some programs coming up. Maybe we can fly you out or something. We got it all working out here, but we'll get you some information on that. And heck,
sounds good.
Yeah, but those 3 kids now, how old are they? Are they getting older? Or
I got 10, 8, and 5 are my kids. So the youngest just started kindergarten. So getting them growing up a little bit, but still young.
Oh, dude. Well, we got Disneyland right around the corner here with California Adventure together, so we can let them go.
They'd love it.
Oh, they would love. That's perfect ages too, man. You have to keep an eye on them, man. You get lost. There's so many people over there, but no, it's fun times. And heck, we got that. We got all sorts of things around here, but definitely love to have you out. And again, we can't thank you enough for all the work and just all the great, work and just staff. And you just can't teach it almost, man. We just love you guys and can't thank you enough.
And we appreciate you guys too. So working well.
All right, baby. Well, good talking to you, and we'll talk to you real soon, Dr. Kifer.
All right. Thanks, Sean.
All right, buddy. Bye-bye.
Bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.